Hello, my name is Champ Baker. I'm the Program Director of the Houston Sports Medicine Fellowship here at the Houston Clinic in Columbus, Georgia. Our fellowship was founded by Dr. Jack Houston. Dr. Houston started the clinic in Columbus, Georgia in 1949. Dr. Houston was one of the founders of AOSSM. He was the first editor of the American Journal of Sports Medicine. And he left us quite a legacy here today, which we are trying to continue. The clinic has a main campus here in Columbus, Georgia. It now has 38 offices throughout Georgia, Alabama, Florida, and Tennessee. Currently, we have 57 orthopedic surgeons, an additional 17 orthopedic trauma-trained physicians at our various trauma sites throughout the Southeast, as well as 8 non-orthopedic medical physicians, including family practice and radiology. Here at the main office, we have subspecialty fellowship-trained surgeons in sports, shoulder and elbow, trauma, spine, total joints, foot and ankle, hand, as well as pediatrics. Regarding our fellowship, it was started by Dr. Houston. The first fellows in 1960. Since that time here, there have been a total of 337 trained fellows, including 47 primary care sports medicine physicians. Our last fellows were trained here in 2016 to 2017. At that time, we were also starting an orthopedic residency program, which takes 3 residents a year. We took a voluntary hiatus from the fellowship to focus on the residency program, which is now thriving and currently in our 8th year with 3 graduated classes. We are ACGME accredited. The Houston Society has over 500 members. The society is formed from people who have trained here at the clinic or have come here and been impacted in some way by the clinic and by Dr. Houston with a mutual shared love of sports medicine. Faculty for the Sports Medicine Fellowship will be through several primary faculty as well as several additional clinical faculty. Primary faculty will include myself, Dr. Brent Ponce, Dr. Matt Tucker, and Dr. Pat Fernicola. Additional clinical faculty include Dr. Fred Flandry, Dr. Kurt Jacobson, Dr. Ryan Geringer, as well as Dr. Jake Gudger. I am Champ Baker. I went to medical school at Medical College of Georgia in Augusta. My orthopedic residency was at the University of Pittsburgh Medical Center under the direction of the late Dr. Freddie Fu. My fellowship was in sports medicine at Rush University in Chicago under Dr. Bernie Bach. My practice of sports medicine is primarily knee and shoulder. I will also do a fair number of elbow arthroscopy as well as hip arthroscopy and a special interest in cartilage restoration. Dr. Ponce went to Vanderbilt Medical School. He did his residency at the Harvard Combined Program under the direction of Dr. James Herndon. He did a shoulder and elbow fellowship at Harvard under the direction of Dr. John J.P. Warner. Dr. Ponce is head of our research. He recently joined us after a distinguished academic career at University of Alabama at Birmingham, where he'd been for about 15 years, and we were happy to have him here at the Houston Clinic. His practice has a shoulder and elbow focus, as well as generalized sports medicine. Dr. Tucker is a native of Columbus. He attended medical school at Medical College of Georgia, residency at the Campbell Clinic under Dr. Fred Azar. He did 2 fellowships, one in sports medicine here at the Houston Clinic under Dr. Baker Jr., and as well as a foot and ankle fellowship in Birmingham under Dr. Jay Gould. Dr. Tucker has a very busy sports medicine practice, as well as a generalized orthopedic practice, including trauma as well as total joint arthroplasty. Dr. Fernicola is the last of our primary faculty. He went to Georgetown Medical School. He did his training through the United States Army, training at Madigan Army Medical Center in Fort Lewis, Washington. He later did a shoulder and sports medicine fellowship here at the Houston Clinic under Dr. Baker Jr., as well as Dr. George McCluskey. Pat's practice is a very extremely busy practice, primarily focusing on knee and shoulder, with an extremely large shoulder arthroplasty practice. Dr. Flandry is part of our additional clinical faculty. He did his residency at Tulane and a sports medicine fellowship here, as well as additional trauma training in Europe. He is very active in our Houston Foundation and our fellowship as our designated institutional officer. Fred has a very busy practice, including generalized orthopedics, sports medicine, as well as a large hip arthroscopy practice, fair amount of knee and hip osteotomies. Dr. Jacobson did his residency at University of Michigan, a fellowship under Dr. Houston in the early 1980s. He is president of our clinic, and he's also the medical director at our Jack Houston Memorial Hospital. Dr. Geringer did his residency through Michigan State, did a fellowship under Dr. Baker Jr. as a director and completing that in 2009, and he's been in practice with us since that time with a very busy sports and generalized orthopedic practice. Dr. Gudger Jr. did his residency through Greenville Hospital Systems and completed an ACE fellowship here at the Houston Clinic for an additional clinical year following completion of his residency, and has been in practice with us over the past 6 years. Fellow rotations will be under me primarily for 6 months, Dr. Tucker for 3 months, and Dr. Fernicola for 3 months to complete the year. We feel like this period of time allows for mentorship, extended patient interactions, including evaluation, treatment, and follow-up of the patient. We feel like the rotations can be very flexible to enable increased surgical experience as well as the depth of experience. Although we do have an orthopedic residency program here at our clinic, no current rotations with the resident on service are planned. We think the surgical experience at our fellowship is very comparable to other programs. Our last 6 fellows, average case logs were 540 with a high of 646. We think here we give a very broad experience both in knee and shoulder as well as hip. Knee experience includes over 120 ACLs a year with an abundance of meniscal repairs. Although my clinical practice does not include any total knee arthroplasties, certainly that is a large part of Dr. Fernicola as well as Dr. Tucker and other clinical faculty's practice, so there is opportunity to do a significant amount of knee arthroplasty if you so choose. Shoulder experience includes a large number of rotator cuff repairs performed a year, as well as with instability cases and a large shoulder arthroplasty practice. Hip experience, there are over 100 hip arthroscopy cases performed a year, as well as with hip abductor tendon repairs, as well as with standard hip arthroscopy, both peripheral and central compartment cases. Fellow education will be performed with didactic lectures in conjunction with our residency program. Sport-specific topics include with primary care, physical therapy, MSK radiology, as well as with practice management. Cadaveric labs at our Surgical Education Center at the Foundation. We do monthly journal clubs, as well as meetings including Georgia Shoulder and Elbow Society, AOSSM, Houston Society, as well as other personal choices, and we also do grand rounds monthly. Fellow qualifications must have completion of an ACGME accredited orthopedic residency program. You need to either be board certified or board eligible, obtain medical licensure both in Georgia as well as Alabama, and the application process is through the San Francisco Match. What are your responsibilities? Dr. Houston liked to say, take care of your patients and they will take care of you. We want you to dress appropriately and professionally. You need to be on time, you need to be prepared, you need to read appropriately for your cases, you need to know your patients and who you are operating on, as well as your indications, why you are in the operating room. And you need to be a team member, which includes our staffs, as well as the staff in clinic and the operating room. Additional responsibilities include athletic event coverage. We cover all the athletics for the Muskogee County School District, as well as 3 of the 4 private schools in the area. You'll be assigned a high school football team, which will be your team to take care of through that season. You will assist with Columbus State University Athletics, a Division II school in town, as well as professional sports coverage. The River Dragons are hockey, Columbus Lions are semi-pro football, as well as the Columbus Rapids, which is a men's and women's soccer team. Help with pre-participation physicals both at the high school and collegiate level. Responsibilities in clinic include work up the patient in clinic, give a diagnosis and plan of treatment. Regarding research, you should have at least 1+ publishable papers at the completion of the year. Dr. Chit Ranawat in New York talked about adult education as self-education. It is your year to learn. We will provide you the opportunity, but it is up to you to take advantage of the opportunities provided. Dr. Bach would also tell me, don't be an asshole. You need to be a good team member and help take care of the patient and work with all providers at all levels. You need to be a good ambassador for your residency as well as your fellowship, and we would want you to join AOSSM after completion of the year and be an active, productive member. Research, Dr. Ponce is Chair of Research here at the Houston Foundation. We currently are using Patient IQ for patient-reported outcomes that they will complete online. We have 2 full-time research assistants. Mercer University, which is based in Macon, Georgia, has a Columbus campus which opened this year. There's opportunity to collaborate with them. VCOM at Auburn University, the Edward Via College of Osteopathic Medicine, is available 45 minutes away for potential biomechanical and animal studies. as well as we have our educational lab up here at the foundation where we're able to perform cadaveric and anatomical studies there. Call is done by the attendings for after hours, managing phone calls and ER coverage, not you. That is not your responsibility as the fellow. There is an opportunity to take paid call at Piedmont Columbus Midtown Medical Center. That's a level 2 trauma center. If you avail yourself of this opportunity, the primary responsibility is still your fellowship and should not interfere with any of your fellow education or responsibilities. Where we are, we're currently over 4 states, Tennessee, Alabama, Georgia, and Florida. The main office is in Columbus, right on the Alabama border, directly in the middle central aspect of the state. We do travel to satellite offices, including LaGrange, just north of Columbus, Auburn, which is slightly west, Dothan, which is southwest, as well as with Albany, which is southeast of the main Columbus office. As mentioned, LaGrange, Georgia, about 45 minutes north. I will go there every Monday, Dr. Tucker every Wednesday, Dr. Fernicola will go every other Monday morning to LaGrange. Auburn, Alabama, Dr. Tucker goes there twice a month. Albany, Georgia, will be Drs. Fernicola and Dr. Tucker each go there twice a month each. And Dothan, Alabama, which gets you halfway to the beach, is a 2-hour drive, and each of us go there twice a month. Facilities include our hospital, the Jack Houston Memorial Hospital, our surgical center, 2 Piedmont facilities in town at Northside and Midtown, as well as primarily the Houston Foundation. Our hospital, the Jack Houston Memorial Hospital, is 100% physician-owned. In fact, it's the only physician-owned general hospital in the United States. There are several specialty hospitals, but we are the only physician-owned general hospital. We have 70 beds, 6 operating rooms. We are located in Phenix City, Alabama, which is about a 10-minute drive from our main campus across the Chattahoochee River. And last year, 5,195 orthopedic cases were performed, which were greater than 90% of the total. We have the Houston Surgical Center, which is attached to our main clinic. It's on the 2nd floor. It's a 2-room surgical suite. There's a sports medicine physician operating there every day of the week. Last year, 2021, over 2,600 cases were performed there in that 2-room suite. Piedmont Northside is located on the main campus. It was originally built for Dr. Houston in 1984. It has undergone several ownership changes. It's currently owned by Piedmont System. Few cases are performed there from a fellowship standpoint, primarily done for insurance purposes or for those of us who take call there and who require to perform cases from on-call. Other facilities include the Houston Foundation. It's the physical building located on the main campus. The foundation was originally developed for Dr. Houston's research and for teaching Tulane residents back in the 1960s. It was later incorporated into a 501c3 nonprofit. It's for private research, education, and training. In 1985, the physical building was built. It does have a local community board which governs it. Through the foundation run our Sports Medicine Fellowship, our Trauma Fellowship, the Advanced Clinical Experience Fellowship, as well as the Athletic Training Program. Here in the foundation, we have a medical library. We also have a wet and dry laboratory where we are able to perform anatomic studies as well as hold meetings to discuss surgical techniques, try out new implants, train residents, as well as train fellows. We also have medical illustration and photography capabilities to help perform illustrations for publishable papers, as well as novel research. The photographers are able to come into the operating room as well as take photos, which are much better quality than those on our phone. We also have a medical illustration department where they can do original drawings to pair with your research, as well as do reprints for book chapters, etc. We also have video capabilities. You can produce and edit videos, such as for surgical techniques, research projects, or for your presentations. The foundation staff is led by Belinda Klein, who's our executive director, as well as director of medical imaging, Charlie Minton, who runs our lab and is our research coordinator, Robbie Ross, who's the AV director, Denise Brogdon is our librarian as well as medical writer, and Andy Grubbs, who's our director of athletic training. We are here in Columbus, Georgia. It's the 2nd largest city in the state of Georgia, over 200,000 people in the city and about 450,000 in the greater statistical area. Here there's a comparably low cost of living. We are right on the Chattahoochee River on the Alabama border. We are 100 miles southwest of Atlanta. It takes about an hour and a half to get to the Atlanta airport. From there, it can get to anywhere in the world. We're a 3.5-hour drive to the Gulf Coast, beaches, Panama City, 30A region, as well as 5 hours drive to the Atlantic coast, including Sea Island, Georgia, Amelia Island, Florida, etc. Here in Columbus, there are abundant outdoor recreational activities. In fact, Columbus has the world's largest urban whitewater rafting experience. The 2022 World Cup and 2023 World Championships are actually coming to Columbus to compete on the Chattahoochee River. Just north of town is Callaway Gardens, a very nice family resort. Auburn University gets you into SEC country, 45 minutes away. There are certainly abundant outdoor activities including golf, tennis, hunting, and fishing throughout. I'd like to thank you for taking the opportunity to watch and listen to our presentation. We're quite proud of our fellowship and what we have built here and hope to extend further with your participation. We look forward to interviewing you further, unfortunately virtually, but look forward nonetheless over the next couple of weeks. Thank you.